Let's talk about places anesthesia is administered in the hospital outside of the operating room. Usually we refer to these as our ancillary sites or off-site locations. Those can include MRI, interventional radiology, CT, where else? Those are the three that are popping in my mind. We give anesthesia all over, even going to the actual ICU to give anesthesia for maybe an unstable patient for a TE or even an EGD. So I want to talk about MRI and why sometimes those ancillary and off-site places can present a little more challenge for the anesthesia provider. We're outside the OR, we're outside our norm. Usually we have to travel with, a lot of hospitals have this little tackle box. So we'll have all our airway equipment. Usually we have to bring our own drugs, emergency drugs, our propofol, our ephedrine, phenylephrine, different things, because when you get to the unit or the ancillary site, they may or may not have Pyxis or Omnicell for you to get drugs. So you got to come prepared. So you're coming out of your comfort of your operating room and your little office and space at the head of the bed, and you're going into unfamiliar territory. And usually, depending on how busy the hospital is with those off-site services, it may not be something you do all the time. So you have to get there. And then MRI is very special because I'm sure we've seen stuff circulating, whether or not you've been in an MRI, you've had an MRI. There are things that you just can't bring in the MRI scanner or in the MRI room things have to be MRI safe. So then you have that other thought in your mind. Every time you go to MRI, they wand you down. I pat myself down. I take everything off because I don't want to be responsible for something going into the scanner and they got to shut it down. And then it's a hazard. It's dangerous as well. So you have to prepare for all these things. What can I bring into the scanner that is MRI safe? And then walk through your plan. I've worked places where maybe you have to put the patient asleep outside the scanner, then wheel them in. Or sometimes you have all the MRI safe equipment that you need to put the patient asleep safely in the scanner. Or even if you're just giving some IV sedation, making sure your pumps are MRI safe and how to use them. So as a provider walking into these situations, your mind is spinning. You're going through all the scenarios of how am I going to wake them up? And then also once they're in the scanner, monitoring them, depending on, I've worked in different places with different ways of how their scanner is set up and whether or not they have the control room where you can monitor your patient while outside of the room. And then I've also been places where I sat in the scanner with my patient. It just depends on how it flows and what kind of setup they have and whatnot. And it's loud when you're in there. You wear your ear protection as well. And it can be a challenging case. It sounds real simple. I'm just gonna go do a little sedation or general for a quick MRI scan, but you are hyper vigilant in that situation just because of all the different situations not being in your normal place. And then if you do need some assistance, you gotta hold the fort down for a minute